Am I audible? All of you?
Yes, ma'am.
Yes, ma'am.
Screen, is it visible?
Yes, ma'am.
Okay, so today we will see the Parkinson disease. Okay, yesterday we have seen which disease? In the CNS. In the CNS. Which disease we learned yesterday? Am I audible, all of you? Which disease we learned yesterday? Am I audible, all of you?
Yes, ma'am.
Yesterday you were there, all of you? Are you sleeping or what? What we learned yesterday?
Epilepsy.
Yes, very nice. Epilepsy, okay, one of the CNS disorder. Now, second one, we will going to see the Parkinson's disease. Now, what do you mean by what we have to learn in this? We will see it is a chronic neurological disorder. What? It is the chronic neurological disorder. It is caused by due to the deficiency of dopamine, in the brain. Okay, it is also a brain disease. It is also comes under the CNS disorder. It is a chronic neurological disorder. It is caused by due to the deficiency of dopamine. Dopamine, it is one of the neurotransmitter. So due to the deficiency of this neurotransmitter, dopamine, it causes the Parkinson disease. Okay. It is characterized by 4 cardinal signs. 4 main signs are there. These are the resting tremor. Though you are in the rest, the tremors will be there. That is the resting tremor. Okay, bradykinesia, rigidity, postural instability, all in detail I will explain here. It is characterized by, keep in your mind, the 4 signs which are resting tremor, bradykinesia, that is the slow sluggish movement, okay, rigidity, too much rigidity, and postural instability. We will explain in detail in the etiology. Okay, so see here the etiology. Okay, all these we will see in the signs and symptoms. First we will see the etiology. What are the causes behind this? Okay, one of this one, that is the genetic. Genetics means what? Genetic means what? The genes are passed from parents to the offsprings. Okay, so researchers have identified that the Parkinson disease, PD means what? Parkinson disease appears to be caused by a single genetic mutation. Due to what? Due to a single genetic mutation. Only single changing of these genes. Mutation, that is the changes. Okay. Due to what? A single genetic mutation. In this, what happened? The mutated genes, and these mutated genes, the genes are changed. These changed genes are passed from generation to the generation. These are passed from the generation to the generation, resulting in the Parkinson disease within an extended family from one generation to the another. These will carry on, isn't it? So this is one of the cause, that is the genetic. Due to what? Due to the genetic mutation. Due to the genetic mutation. Now, next one we will see the environmental factors. Second one, that is the environmental factors. Researchers also have identified that the environmental factors may increase the risk of the developing PD. Okay, what is that one? What are the factors in the environmental? That is pesticides and herbicides used in the farming. Due to the pesticides and herbicides which are used in the farming. Okay. Traffic and industrial pollution. Due to the pollution, where in the traffic and industrial pollution may contribute to the development of the PD. Means one of the cause, that is the pesticide and herbicide, where they are using in the farming. And one of the another reason, that is the environmental factor, that is the pollution. Which pollution? May be traffic or industrial pollution, chemical pollution. Okay, that may lead to the Parkinson disease. And the synthetic neurotoxin agent. What's the name? MPTP. That is the chemical name, 1-methyl phenyl. That is the too much long name is there. This is the chemical name. You keep in your mind, that is the MPTP. A synthetic neurotoxin, which is called as a MPTP. It is a synthetic neurotoxin. Okay, can also cause the immediate and permanent Parkinsonism. Due to MPTP, it causes the immediate and permanent Parkinsonism. Okay. So these are the environmental factors. Which are those environmental factors in that environmental? The pesticides and herbicides, which are used in the farming. The pollutions, which pollutions? Traffic, industrial, due to the chemical, any of the pollution. And the another, that is the synthetic neurotoxin, which is MPTP. This is the chemical name, big chemical name is there. You keep in your mind like that only. So this is the synthetic neurotoxin, that is the MPTP, can also cause the immediate and permanent Parkinson. Now next etiological factor we will going to see, that is the Lewy body. Lewy body means what? These are the abnormal deposition of the proteins. These Lewy body means what? These are the clumps of the specific substance. Which specific substance? That is the abnormal deposition of the proteins within the brain cells. Within the brain cells, due to deposition of these specific proteins in the brain cells, that causes the Parkinson disease. Okay. Due to these Lewy body, these are abnormal. These are not normally. Okay, so these abnormal deposition of proteins, that is called as, that clumps we called as a Lewy body. That clump we called as a Lewy body. These are the microscopic markers of the Parkinson disease. These are the microscopic markers of the PD, and that are called as a Lewy body. This is the main important cause of the Parkinson disease. Now next one we will see one of the cause, that is the synuclein. This is a protein. This protein is found in the Lewy body. This protein, synuclein, these are found in the Lewy bodies, are important cause of the Parkinson disease. That cluster we called as a Lewy body, and inside that one, the deposition of protein. Which protein? A synuclein. A synuclein. These synuclein proteins are found in within the Lewy bodies, are the important cause of the PD. Are you getting? These are one related to one another. These are related to one another. This cluster we called as a, means what? In a group of this one we called as a Lewy body, and that protein we called as a synuclein. These are the main causes of the Parkinson disease. Now next one, that is the viral. Due to the viral infection, due to the brain infection, exposure to the certain drugs may causes the Parkinson disease. Okay, due to viral infection, due to brain infection, due to exposure to the certain drugs. Okay, in the young age, what happens? 18 to 35, due to the trauma, due to the alcohol withdrawal symptoms, alcohol withdrawal. Okay, drug addiction and brain tumor causes the Parkinson disease, sudden withdrawal. Okay, this is due to trauma, due to alcohol withdrawal, sudden withdrawal, and due to the drug addiction and due to the brain tumor. Okay. In the older age means what? Above 35, more than 35. Due to what? Cerebrovascular abnormalities. Due to cerebrovascular abnormalities. Metabolic disorders. Which type of metabolic disorders? Like the uremia, hepatic failure, electrolyte imbalance, blood glucose imbalance, Alzheimer disease, CNS, other CNS disorders. Okay, due to all these, it causes the Parkinson disease. Okay, next we will going to see the Alzheimer disease. Then you will understood this one. What do you mean by what? Okay, so other CNS disorders, other these metabolic disorders like uremia, hepatic failure, electrolyte imbalance, blood glucose imbalance, these are the factors which are causes Parkinson diseases. Are you understood this one etiology? What we studied in this etiology? In this etiology, actually, this is due to the deficiency of dopamine in the brain, which is the main cause behind this Parkinson disease, deficiency of dopamine. Now, the other we will see that is the genetic due to the single gene mutation. Due to that changing of the gene, it passes from generation to generation, and that is one of the cause. Okay, and the environmental factors, which are those one environmental factors? In the pesticide, herbicides, which are we are using daily in the farming. So one of the cause, and the other pollution, and one of the main, that is the synthetic neurotoxin agent, which we call that is MPTP. You keep in your mind MPTP like that only, because this is a chemical name. It is a very long one. That is the MPTP. Okay, that is the synthetic neurotoxin agent. It causes immediate and permanent Parkinsonism. Immediate and permanent Parkinsonism. Keep in your mind. And next one, that is the Leo body. Leo body means what? Means what? Clumping of the specific substance, deposition of the clusters of the specific substances. Which are those substances? That is the abnormal deposition of the proteins within the brain cells. This causes the Parkinson disease. Okay, and the synuclein. Synuclein means what? A deposition of the protein we told here in the Levy body, isn't it? Which protein? This is the synuclein protein. A synuclein proteins are found within the Levy's body, are important cause of the PD. These are one related to one another. Next one, that is the viral infection, brain infection, exposure to certain other chemicals or certain other drugs. Okay, due to the trauma, sudden withdrawal of the alcohol, drug addiction, or brain tumor. These are the reasons, these are the causes of this Parkinson disease. In the older age, the more than the 35, that is due to what? Due to what here? Cerebrovascular abnormalities, metabolic disorders like the uremia, hepatic failure, sorry, electrolyte imbalance, blood glucose imbalance, Alzheimer disease, and CNS disorder other. Okay, these are overall the etiology. Now we will going to see the pathogenesis. Genesis, that is the progressive development of the disease. Pathogenesis, that is the development of the disease. How the Parkinson develops. See, here the extensive and progressive loss of the dopaminergic neuron in the substantia nigra pars compacta. This is the area in the brain. This is the area in the brain. Due to what? We know the etiology. What? Deficiency of the dopamine. Dopamine, that is one of the neurotransmitters. So what is the pathogenesis? How the development of the disease takes place? Extensive and progressive loss of these dopaminergic neurons. These dopaminergic neurons. Due to loss of these type of dopaminergic neurons, there is a loss of secretion of dopamine in the brain. This is the substantia nigra pars compacta. This is the area of the brain. Okay, in that area, there is a progressive loss of dopaminergic neuron. And what happened due to that? This results in deficiency of dopamine. This causes loss of dopaminergic neuron. This causes the deficiency of dopamine, isn't it? And due to that deficiency, what the main role of the dopamine, which controls the muscle tone and coordinates the movement? What is the main cause? What is the main function of the dopamine? It controls the muscle tone and the coordinates the movement. If there is a deficiency of dopamine, this causes what? There is an imbalance between the dopaminergic and cholinergic excitatory system. Okay. Dopaminergic, this is the inhibitory in action, and cholinergic, this is the excitatory in action. There is an imbalance between this dopaminergic and cholinergic system. So it occurs rise in the motor effect, and due to this causes the Parkinson disease. Stratum, this is the one of the main input areas of the basal ganglia. Here we explain this one, stratum. In the stratum, stratum means what? It is a primarily the dorsal stratum. It is one of the main input areas for the basal ganglia. Are you understood this one? Pathogenesis. Pathogenesis, simple way, loss of dopaminergic neurons. Due to loss of neurons, this dopaminergic neuron, there is a deficiency of dopamine. Due to the deficiency of dopamine, it causes the Parkinson disease. There is an imbalance between the dopaminergic and cholinergic system in the stratum, and this causes the Parkinson disease. This is the simple development of this Parkinson disease. Are you understood all of this? Next one, we will going to see the symptoms. What we studied before only, the four cardinal signs, that is the resting femur, bradykinesia, rigidity, and postural instability. Here I will explain in detail. See here, the main cardinal signs, these are the tremor. Tremor means what? It is a usually resting tremor. It is usually a rest tremor. Maximal when the limb is at the rest. When the limbs are at the rest, the tremor, shaking is there, and disappears during the voluntary movement and sleep. When it appears only when the resting period, means maximum when the limbs are in the rest, not working in position, and disappears during the voluntary movement and sleep. Voluntary movement, if we are in the working, these tremors will disappear. And when we are in the sleeping condition, when we will sleep, these tremors will be disappear. When they will appear? Only when the limbs are at the rest. We will keep like this only, in the rest only. We are not working position. That time the tremors, the shaking is there. When the movement is there, when we are in the working position, that time the tremors will disappear, and at the time of the sleep, these tremors will disappear. Okay, are you getting this one? It affects the part of the limb. It affects the distal part of the limb. Distal part at the end, that is the fingers and everything. Okay, not to the upper side, distal portion of the limb. Okay, the fingers will shake. Okay, only. At the onset, it appears only in a single arm or leg. During the first time, onset, starting, it appears only in the single arm or leg. Only one arm or the leg, single. Progressing bilateral organs later. As the disease progress exaggerated, then may appear both the sides, bilateral, both the sides. Okay, frequency of PD, Parkinson disease tremor, is between 4-6 cycles per second. How much the time period? That is the 4 to 6 cycles per second. How much per second? 4 to 6 cycles, these tremors per second. Okay, per second. You keep in your mind this one. Are you understood this one, tremor? Actually, tremor means this is the shaking. Okay, resting tremor. Actually, this is a resting tremor. Maximum when the limbs are in the at the rest and disappears during the voluntary movement. When we are working, that will disappear. When we will sleep, at the time also this tremor will disappear. And in the initially it appears only in a single arm or a single leg. Okay, and as the disease progress, as the disease develop, exaggerated, at that time it will appear both the sides, that is the bilateral organs later. Frequency of this PD tremor been between 4 to 6 cycles per second. How much? 4 to 6 cycle per second. Now we will see the next sign, that is the bradykinesia and akinesia. Bradykinesia means what? Slow, sluggish movement, like a robo. You see, no, that one, the slow motion. How it is? Like that, our body movement, slow, sluggish movement. And akinesia means what? Stopping of the movement all over, almost stop of the movement. That is called as akinesia. First, that is the bradykinesia, means slow, sluggish movement, like a robo. Okay, slow, sluggish movement. Okay, and akinesia means what? Stop all the movements, can't move any part of the body. Okay, that is the we called as that we called as a akinesia. This is the most characteristic feature of the PD. Bradykinesia and akinesia. This is the most characteristic feature of the PD. All the movement will be slow. All the movements. Okay. Not only the voluntary out, all the movements will be slow, sluggish, and akinesia. As the disease progressive, the individual can't move from one side to the another side, and also it can't swallow the material. This also one of the movement. Not only the movement, that is the leg movement, hand movement, and other movement, but other movement, that is the person cannot swallow the food material also. Okay, can't swallow the water also, liquid material also. All the movements are bradykinesia, that is the slow, sluggish movement. And as the disease progress, develop further, akinesia, the person can't swallow, can't eat, can't move from one placement to the another one. Okay, this is the characteristic, most characteristic feature of the PD. Now next one, that is the rigidity. The muscle tone, it is too much rigid, that is the too much contractions of the muscle. Okay, too much contraction, it is characterized by increased muscle tone, that is an excessive and continuous contractions of the muscles. Too much contraction, that is the rigidity. It produces stiffness and resistance to move in the joints. The joints will not move, isn't it? We can't move. So that is due to the rigidity. Due to what? Increased muscle tone, increase the contraction of the muscles due to the muscle tone. It is associated with the joint pain. Due to that, we causes pain. Okay. Are you understood this one? Rigidity. Why the rigidity? Why the rigidity? Due to the increased muscle tone. In that, the excessive and continuous contraction of the muscle. Excessive and continuous contraction of the muscles. It produces what? Stiffness and it resists to further movement in the joint. Stiffness, it produces stiffness and resists to movement in the joints. Due to this, it causes the joint pain. Are you getting? Now, next one, this is the postural instability. Postural instability means what? It is observed in the late stages of the PD, means fully developed one, too much. That is the late stages of the PD. It leads to impaired balance. It leads to impaired balance, frequent falls, possibly leading to the fracture, more common in the older patient. Due to that instability, the patient, the individual can't stand, can't move. That is the postural instability. And due to that, it leads to impaired balance. Okay. And due to that imbalancing, the individual will frequently falls and there may be chances of accident or there may be chances of fracture. Okay. These symptoms more commonly occur in the older patient. Fracture because already the bones are weak and so that the fracture will appear. Okay. Due to older age because already the bones are weak and due if the individual is having PD, Parkinson disease, and due to that postural instability, what happens? The individual will fall down, isn't it? And due to that, there may be appearance of the bone fracture. Okay. Now the other symptoms, are you understood? These are these four main symptoms. These four main symptoms, these are very important. You have to keep in your mind. Which are those? Tremor, bradykinesia, and akinesia. Next one, rigidity. And next one, that is the postural instability. These four you have to keep in your mind because these are the main signs and symptoms. Now, other are also there. Other symptoms we will going to see loss of sense of smell. Due to this, it causes what? The signs and symptoms, loss of sense of the smell. We call it as a, in the medical terminology, anosmia. Anosmia, loss of sense of the smell. Nerve pain is there. Urination problem is there. Constipation, erectile dysfunction in men, sexual dysfunction in women, dizziness, giddiness, blurred vision, due to contraction, isn't it? All the muscles will get contract, isn't it? So due to that, the blurred vision, eye muscles will also contract, isn't it? Fainting and fatigue. Okay. Weakness is there. Excessive sweating is there. We call it is a medical terminology, hyperhidrosis. That is the excessive sweating. Swallowing difficulties. Swallowing difficulties. These are called as a dysphagia. Swallowing difficulties, that is a dysphagia. Due to this slow sluggish movement, it appears here also. Slow swallowing difficulties. Before only I explained. Excessive production of saliva, that is we called as a drooling. That we called as a drooling. Excessive production of saliva because the swallowing problem. That's why whatever saliva secretes, it will be in the mouth only. That is the excessive production of the saliva. Depression and anxiety. Due to all these, the individual can understand all these one but can't do anything, isn't it? The brain is working but can't understand, can't do anything. So there is a depression and anxiety. There is a depression and anxiety. Insomnia means what? Sleeping problem. The individual can't sleep properly. So this terminology we called as a insomnia. Dementia means what? Learning problem. Okay. Loss of memory loss, dementia, little memory loss, that we called as a dementia. Mild cognitive impair. These are related to one another. Dementia and cognitive impair. Cognition means remembering. The person can't remember the things, can't remember the things, that is related to dementia. Same, memory hampers, and here also memory, mild cognitive, one and the related to one another. Okay, mild cognitive impairment. These are the other symptoms. Are you understood all these one? See once again, four main signs and symptoms. Which are those one? Tremor, bradykinesia, akinesia, rigidity, postural instability. Others, loss of sense of the smell, nerve pain, urination problem, constipation, sexual dysfunction, erectile dysfunction in men, dizziness, giddiness, okay, blurred vision, fainting, fatigue, okay, excessive sweating, hyperhidrosis, swallowing difficulties. You have to keep in your mind all these one signs and symptoms. Excessive production of saliva that we called as a drooling. Okay, depression, anxiety, insomnia, can't sleep. That is the insomnia, dementia, mild cognitive impair. These are all about the signs and symptoms. Now we will going to see the diagnosis. How the diagnosis, how the we have to do the diagnosis. These are, there are too many diagnostic tests are there, isn't it? So first, that is the medical history. On the basis of medical history and neurological examination of the patient, how we have to diagnose? Overall, we have to take the medical history. Okay, the doctor will take the medical history first, and then only the doctor can diagnose the individual is suffering from this and this disease. Okay, and the neurological examination of the patient. By neurological examination, we can understand, we can diagnose the individual is suffering from this and this disease. And next one, that is the scan, brain scan. Okay, scanning of the brain. Due to that also we can understand. Okay, we will take here the photographs. And next one, people may be administering levodopa. Actually, what happens here? There is a deficiency of dopamine, but dopamine we can't give. We know the deficiency of dopamine, but dopamine we can't do because it will metabolize fastly. So the precursor we will give, that is the levodopa. The precursor we will give levodopa to get relief from the motor impairment and confirm the diagnosis. If we will give dopamine, levodopamine, that it acts as a, when it will crosses the blood-brain barrier, when it crosses the blood-brain barrier, what happens? It convert into the dopamine. It is converted into the dopamine because levodopa, it is a precursor of the dopamine. Why we are not giving directly dopamine? It will decarboxylase, isn't it? Immediately, it can't. It will not go. It will not process the blood-brain barrier where the deficiency is in the brain. In the brain, so it has to cross the blood-brain barrier. But what happens? We know the deficiency of dopamine. So if we will give the dopamine, what happen? If we will give the dopamine, it will not crosses the blood-brain barrier. But where the disease problem is there? In the brain, isn't it? So we are giving here the levodopa. Levodopa, it is the precursor of the dopamine. Levodopa, it is the precursor of the dopamine. So if we will give the levodopa, what happen? It will cross the blood-brain barrier. Okay, so when it will crosses the blood-brain barrier, it will reaches to the brain where the actual deficiency is there. So levodopa, when it will process to the blood-brain barrier, and when it reaches to the brain, it is converted into the dopamine. So it will fulfill the dopamine deficiency. So it will fulfill the deficiency of the dopamine. And so what happen if the patient is, if the individual is suffering from the dopamine deficiency only, then immediately it will, the individual will get relief from the motor impairment. So that we understand, we conclude, we diagnose if the individual is suffering from this and this is Parkinson disease. Are you getting this one? Are you getting this one?
Yes, ma'am.
Now next one, see the diagnosis. Okay, the presence of Lewy body, the presence of Lewy body in the midbrain on autopsy is usually considered as a proof of the PD, Parkinson deficiency, Parkinson disease. What is the main cause of this Parkinson disease? There is the saturation, there is a deposition of the Leo body in the brain, okay, midbrain. So when we'll take the autopsy, when we will take the autopsy, if there we found there is a deposition of the Leo body, then so that we can confirm, we can diagnose, okay, individual is suffering from Parkinson disease by taking this autopsy, by taking that small piece of that one immediately, and if we will diagnose, and when we will found there are the presence of Lewy body, so that it is confirmed, it is diagnosed, the individual is suffering from Parkinson disease. And the other one, that is the CT scan, MRI, we will take the pictures, isn't it? Because of this MRI and CT scan, we well known of this one, no need to explain again. Okay, all these CT scan, MRI, which MRI we will take here, which CT scan we will take here, the brain. Which part? Brain, because the disease is of brain, disease is of central nervous system, so that's why we will take the CT scan and MRI of here brain. Okay, a special technique of MRI, diffusion MRI, has been reported to be useful at discriminating between the typical and atypical Parkinson. One standard method is there, that is the diffusion MRI. Okay, and because of that, we can more clear patient is suffering from this one, Parkinson disease. Okay. Now, the PET and the SPECT scan means what? Dopaminergic function in the basal ganglia can be measured with PET. PET, that is one of the type of the scanning, positron emission tomography. PET, we seen this one before also. PET scan means what? Positron emission tomography. And SPECT means what? A single photon emission computerized tomography. These are the scanning method, PET scanning method and SPECT scanning method. SPECT means what? Single photon emission computerized tomography. Okay, these are the radio tracers. Because of this, we can understand the dopaminergic function in the basal ganglia, dopaminergic function in the basal ganglia because of this scanning method, PET and SPECT. A pattern of reduced dopaminergic activity in the basal ganglia can be helpful in the diagnosis of the Parkinson disease. We will see due to that activity, which activity? Dopaminergic activity, reduced dopaminergic activity in the basal ganglia can be aid in the diagnosis of PD, means what? Can be helpful in the diagnosis of the PD. So these are all about the diagnosis. What type of diagnosis we studied? Medical history. Due to the medical history, neurological examination, we can diagnose patient is suffering from this and this Parkinson disease. And which this one? Autopsy, CT scan, okay, and MRI. And which scanning other? The PET and the SPECT scanning, and other working reduced the dopaminergic activity. And by administering the lower dopa, by administering the levodopa, we can relieve, if the patient is relieved from the motor activity, then we can understand, we can confirm the patient is suffering from Parkinson disease. Okay, understood this one diagnosis? We will go to the next, that is the treatment. Now treatment, we know the main cause of behind this disease is what? Deficiency of dopamine. So actually what we have to correct, how we have to correct this disease? By giving the dopamine, isn't it? Thus by giving the dopamine, but directly we can't give the dopamine, isn't it? Because dopamine, it is not crosses the blood brain barrier, it will not cross the blood brain barrier. And where the dopamine deficiency? In the brain. So if we will give the dopamine, it has to reach to the brain. by crossing the blood-brain barrier, but it can't. So we are giving the precursor, that is the levodopa. So what happened? Levodopa, it crosses the blood-brain barrier, and when it reaches to the brain, it is converting into the levodopa to dopamine. It releases the dopamine, and the actual deficiency is fulfilled. There is a deficiency of dopamine. If we will give the levodopa, it will releases after crossing the blood-brain barrier. It releases the dopamine. So fulfillment is there. So we can cure the disease. Recently, a number of levodopa potentiates and dopamine antagonist has been developed as the adjuvant. Other or drug treatments are there. That is the levodopa agonist or levodopa precursors are also there. Other other than the levodopa, which are those one? Drug affecting brain dopaminergic system. See, one or two drug treatment you have to keep in your mind, because in the college you will study here in the second year all this one. Okay, so 2 3 you, that is sufficient for you in this year. Dopamine precursor, that is the levodopa we explained. Peripheral decarboxylate inhibitors, that is the carbidopa. Levodopa we have to give along with the carbidopa, so that why decarboxylation of levodopa we can avoid. Next, others are also there: MAO inhibitors, COMT inhibitors, dopamine facilitator. These are the too many drugs are available nowadays. Not only the single levodopa and carbidopa, others are also available as a agonist which favors the treatment. Okay, to that type of the drug. Okay, the action which favors, like the same action of that of the dopamine, that is the agonist, same action. Drug affecting brain cholinergic system. Brain cholinergic system also we can give, that is the central anticholinergic, antihistaminics also we can provide. Lastly, that is the surgical procedure. What we have to do here, which type of surgery we will give here to that patient, that is the deep brain stimulation. We have to stimulate the brain deeply. What is the procedure is there? See here the methodology. In the deep brain stimulation, what is there? Electrode is implanted into the specific part of the brain. Electrodes we have to implant into the specific part of the brain. These electrodes are connected to the generator, implanted in the chest near the collarbone. Okay, and and that sends the electrical pulse to the brain and may reduce the Parkinson symptoms. This type of the surgery means we have to implant the electrodes, and that will gives the electrical pulses, and that due to that electrical signals, that electrical pulses, it reduces the Parkinson disease. Okay, these are all about the treatment. Actually, you have to keep in your mind there is a deficiency of dopamine, so we have to fulfill that dopamine. So that precursor we have to give, that is the levodopa. If we will give along with the carbidopa, it inhibits the peripheral decarboxylation of the levodopa. So that's why 100% levodopa will process the blood-brain barrier, and there it will causes its action. This is all about the treatment. Others are also there. You keep in your mind, that is the MAO inhibitor, monoamino oxidase inhibitor, COMT, cholinergic. This one, what? And what? COMT means choline esterase oxide. This one, methyl transferase. This is one of the enzyme. COMT. This is one of the enzyme that inhibits and dopamine facilitator. All these are the drug treatment. Okay. And lastly, that is the surgical. If no option, we have to give the surgical procedure. Okay, by which method? By deep brain stimulation. Okay. Now, what are the risk factors? Age. heredity, sex, exposure to the toxins. So these are the risk factors. Age, if the people develop the disease around the age of the 60 of beyond the age of the 60 or of the other than other older 60, 70, above the 60, then there is a risk. Why risk? Because of the slow sluggish movement, because of the akinesia, because of the rigidity, there are the chances of fall down and there may be chances of fracturing of the bone. So that's when it is a risk. Hereditary, the presence of the close relative with the PD increases the chances of development of the disease. Heredity, it is a hereditary disease because of mutation of the genes. It transfers from the one generation to another generation. So there is a risk factor of this one. Sex, men are more likely to develop PD than women. Keep in your mind that one. Men are more develop the PD than the women because other the reasons are also there. So you keep in your mind same like that only. Exposure to the toxins. Which exposure? Due to the environmental exposure we've seen. Okay, pollution is there. The in the farms, that is the herbicide, pesticides may increase the risk of the PD. Okay, these are the risk factors: age, hereditary, sex, that is exposure to the toxins. Complications. Which complications are there? Thinking difficulties because of the anxiety and tension, isn't it? So thinking difficulties, depression and emotional changes, swallowing problems, sleep disorders, bladder problem, constipation, blood pressure changes, smell dysfunction, we can't smell, the fatigue, pain, sexual dysfunction, more complexities are there, isn't it? Due to this deficiency of dopamine, due to this Parkinson disease, many more complications are there. So we will cover this disease. We will see another one, that is the, in short, we will see memory points. Okay. Again, I will share one how you have to remember this one. Say, Parkinson means what? In short, I will explain once again. Parkinson, it is the chronic neurological disorder. First, you should know when they will write exam, if they will ask you Parkinson disease, then you should know this is a central nervous system disorder. So that you have to write down first only the chronic neurological disorder. Neurological, neurons are damaged, so that's why it is the chronic neurological disorder. It is not the acute one. It is a chronic neurological disorder caused by due to what? Deficiency of dopamine. What are the signs and symptoms? 4 cardinal signs are there. These are very, very prompt one. Resting tremor, bradykinesia, akinesia, rigidity, postural instability. Etiology, what are the etiology? Causes are there. Genetics, passing from one to another, that is due to the mutation. Environmental, that is the pollution and herbicide, insecticide, isn't it? Levy bodies, the abnormal deposition of the proteins. And which protein? That is the synuclein protein. This is the main protein responsible for it is available, it is found in the Lewy bodies. Okay, due to the viral infection, due to the brain infection, exposure to certain chemicals, exposure to certain drugs, and in the young age due to what? Trauma, alcohol withdrawal, sudden alcohol withdrawal, drug addiction, brain tumor. In the older age due to what? Cerebrospinal abnormalities, metabolic disorders like the uremia, hepatic failure, electrolyte imbalance, blood glucose imbalance, Alzheimer's disease, due to the Alzheimer's disease, due to the CNS disorder. Okay. And pathogenesis due to what? It is the loss of dopaminergic neurons. There is a loss of dopaminergic neurons. There is a deficiency of dopamine, isn't it? So there is an imbalance between the dopamine and cholinergic system. And due to that, it causes the Parkinson disease. Okay. Symptoms: Four main symptoms are there: tremor, bradykinesia, and akinesia, rigidity, postural instability. Other symptoms are also there, that is the loss of sense of the smell, nerve pain, urination problem, constipation, erectile dysfunction in the male, sexual dysfunction in the woman, dizziness, giddiness, blurred vision, fainting and fatigue, excessive sweating, swallowing difficulties, excessive production of the saliva, depression and anxiety, insomnia, mild cognitive impairment. How we will going to diagnose? By taking the medical history, by neurological examination, by scanning of the brain, by administrating the levodopa, so that we can relief from the motor. If the patient is get relief from the motor impairment, then what happen? We can confirm that one if patient is suffering from Parkinson disease. In presence of the Leo bodies in the midbrain, autopsy, main that is the autopsy. Okay. Then other scanning, CT scan of the brain, MRI scanning of the brain, and other PET scanning, SCP CT scanning, radio. These are the scanners, radio tracers. Okay. So other, that is the a pattern of reduced dopaminergic activity in the basal ganglia can be helped in the diagnosis of the Parkinson disease. These are all about the diagnosis. Now treatment, you keep in your mind, that is PD is deficiency of dopamine. So we have to fulfill the dopamine deficiency. How we will going to fulfill this deficiency of dopamine? By giving the precursor of the levodopa. And the other one, recently other drugs are also there, agonist, dopamine agonist are also there. That is the MAO inhibitor, COMT inhibitor, isn't it? So surgical procedure, another one, that is the deep brain stimulation. Deep brain stimulation. The risk factor, which are the more risk factors are there? If the patient, if the Parkinson develops in the elder age, there is a more risky for them because they will fall down, isn't it? Due to the this slow sluggish movement, akinesia, bradykinesia, rigidity, there will be chances of the bone fracture because these, after that one, this age, the bones are weaker. So that hereditary problem, sex, that is exposure to the toxins, isn't it? These are the risk factors. Complications, which complications are there? They will not think properly, that is the thinking difficulties, depression and emotional changes every time. Swallowing problems are there, sleep problems are there, bladder problems, constipation, smell dysfunction, fatigue, pain, sexual dysfunction, blood pressure changes every time. These are the complications of this disease. Are you understood this one? Shall we stop here only? Shall we stop here only?
Yes, ma'am.
Yes, ma'am.
Okay, chalo bye.